Cape Cod Broadcasting weaves the listening environments of 99.9 WQRC, Ocean 104.7, WFCC Classical 107.5, Cape Country 104, and CapeCon.com's website experience to reflect the lifestyles of the people who live, work, and play on Cape Cod. We hope that you enjoy this podcast.
I'm Laura Reckford, and this is Sunday Journal. We're talking about Cape Cod Healthcare's expansion of their emergency centers. Both Cape Cod Hospital and Falmouth Hospital are in the midst of major changes at their emergency centers. The project is one of 5 local beneficiaries of the Seaside Le Mans, a charity race that takes place annually in Mashpee Commons. I'm here in the studio with Art Mombourquette, COO of Cape Cod Healthcare, Dr. Craig Cornwall, Medical Director of the Cape Cod Hospital Emergency Room, and Deb Robinson, Executive Director for Patient Care at Cape Cod Hospital. Welcome to the show to you all.
Thank you.
Thank you.
Let's start with an overview of Cape Cod Healthcare because some of our listeners might not realize the extent of the company's involvement in local healthcare here on Cape Cod. It's not just the hospitals. Art, can you give us an overview?
Sure, I'd be happy to. So we are 2 hospitals. They're the anchors of the organization. One here in Hyannis, obviously, Cape Cod Hospital, which is approximately 250 beds, and Falmouth Hospital, about 100 beds on that campus. We have 5 outpatient centers spread across the Cape, one in Harwich, one in Chatham, one here in Hyannis, one in Mashpee, and one in Bourne, and quite a few sites for our clinical laboratory as well, spread throughout the Cape.
Now, Cape Cod Healthcare has started these 2 major expansion projects on its emergency departments at both hospitals. Can you explain the projects, sort of an overview, and why they are being done? Art?
Sure, I'd be happy to. So we embarked on a project to expand both access and comfort and space within our emergency departments. A couple of years ago, the planning began both on the Cape Cod campus and the Falmouth campus. The original emergency departments on the 2 campuses were designed to provide care to a combined 80,000 patients, roughly, and in 2012, we saw over 130,000 patients, and we're on track probably to see another 115,000 in the combined emergency departments this year. So the projects really are about access, making sure that we have ample accommodation for the volume that we see, and specifically the volume during the summertime. And it's about patient privacy and patient amenities and making it as efficient a care center for the people who provide care there, both our nurses, doctors, and other caregivers.
Now, what stage are you at with the 2 projects? Because one of the unusual things is that you're doing both of these big projects at once.
We are. Both of them are in the steel erection stage, and things are moving very, very quickly. Once all of the utilities get in the ground, the steel goes up quickly, and you'll start to see walls very soon on both projects. Each project will be ready for our summer influx next spring. By May of 2015, the expansions will be complete. There'll still be some backfill projects going on, but mostly dedicated to administrative and support space, but the patient care areas will be ready by May of 2015.
Now, Dr. Cornwall, I know you've worked on the committee that's been in charge of this project and working with this project from the beginning. Can you talk a little bit about the target audience for these spaces and how you came up with designing them, the plans for designing them?
We've really tried to gear this project towards our clients, which on Cape Cod are elderly, tourists. So we had to have a place that it could accommodate a volume surge in the summer that could really meet the needs of our baseline patients, which are an older group of clients. So we spent a lot of time touring around New England and as far as New York, looking at facilities that did things well, did things less well, and tried to learn from both and incorporate that. We also have had specific groups come down and talk to us that are consultants regarding geriatric healthcare, try to educate ourselves in trying to take the best practices we can from them. So we really tried to model this as best we can. One of the things that's interesting about it is for an ER, at least at Cape Cod Hospital, our size, it's a relatively unusual phenomenon to see 90,000 patients in a community setting. Most of the places in New England that see that volume are academic centers, which have a very different patient flow and staff flow. So we didn't have a lot of direct comparisons that we could find, so we had to come up with a lot of it on our own. So we had a good architectural team, and we tried to come up with something that we think will function quite well.
Now, how different is it on Cape Cod? Because as those of us who live here year-round know, we are a year-round community with 215,000 or so people. But, of course, we have this major increase in the summer. And how does that affect the emergency departments?
It affects us primarily. We incur most of that change in volume. So in a typical off-season shift or day, we'll see 230 patients in an off-season, whereas a typical summer day, we'll see 310, 315. So you have to be able to accommodate for that. So we may be relatively oversized in January, but that's necessary to make sure that we're right-sized for July and August. So that was really part of the project, is to make sure that we could deal with that flux efficiently, because those patients need the same quality they get in the off-season as well.
And this idea of planning for these projects, and I'm sure it started many years ago, in fact, and so interesting that you visited other departments, and I'm sure you held a lot of meetings to determine what exactly you needed for the future. What was your thinking about planning for the future and the volumes that might come in future years? Deb?
Well, I think that we actually took what we know works in our current emergency center, and we looked at some of what the other facilities have to offer, and we combined this plan to come up with what we've designed for this current EC. So we took what's working, we know what isn't working, and we have historically done a very good job of flexing up and down with our volumes. So we feel that we understand that process well, but we definitely needed to focus in on safety for our patients and privacy for our patients, and those were areas that we knew we had room to improve on.
I'm Laura Reckford, and this is Sunday Journal. We're talking about the expansion projects at Cape Cod's two hospitals, Cape Cod Hospital and Falmouth Hospital. Talking about design flows in terms of patient care and how that played a part in designing these two new emergency centers. Art, can you speak to that a bit?
Sure. The front door of any emergency department is the triage area, and providing a quick look at how the patient is presenting, and getting them quickly to their site of care. Every emergency department is built with a waiting area, but we like to see our waiting area empty. And that's really the goal of most emergency medicine departments these days. We want to make sure that somebody gets quickly from the triage area into the appropriate treatment area, and that their physician is available to see them right away and move them through the process. And that requires that a fair amount of thought goes into what types of patients are put in what location within the center. So we've designed an emergency department that has a central core of support space for nursing, all of the allied health professionals and the physicians as well, with sort of a racetrack design with the treatment rooms on the exterior of the building. It provides line of sight, which is incredibly important, into each of the rooms from the nursing station, and also for emergency situations, it's laid out in such a way that a caregiver can get quickly into a room if needed.
And one thing we talked about a little bit before the show started is this idea of doing both of these very large projects at the same time. What was the reason for that, Art?
Well, the need was there at both campuses, obviously, and we are always very thoughtful about making sure that what we do on one campus is equally is done equally as well at the other. We are one system. We believe that it's incredibly important that you get the same level of care and the same quality of facility at either Falmouth or Cape Cod Hospital.
And what, for those people who might not have visited both hospitals or may have visited just one and not the other, what square footage what is the size of each of the hospitals, and then what is the size of the new emergency centers? How do they compare?
So Cape Cod Hospital is approximately 500,000 square feet, and the new emergency department will be 54,000 square feet. As Dr. Cornwall mentioned, it's a very big space and designed really for our peak seasons. It's also designed to be very flexible. If we were to decide in the future that it needed to be used differently, it's built using a pod design where there are 4 patient rooms per pod, and you could, in the future, if there are changes in the healthcare marketplace, think about utilizing the space differently. So a lot of thought went into how that was built. Falmouth Hospital is approximately 200,000 square feet of the entire facility, and the new EC is 24,000 square feet.
And these 2 different projects, obviously you would have had to start probably many years ago with the fundraising for them, and I know they've each received a lot of support from the community. Let's talk about that, the fundraising support for these projects, what you were looking for from the community in terms of support and how that is going.
Sure. We're incredibly thankful for the support we've gotten from the philanthropic community here on the Cape and off the Cape as well, folks that utilize our facilities, whether they live here permanently or are part-time residents on the Cape. Approximately 50% of the cost of building these 2 facilities will be provided by philanthropic support, and we couldn't be happier or more thankful for that.
Now, Dr. Cornwall, as medical director of the Cape Cod Hospital Emergency Room, I'm sure that was a lot of talk in advance of the project in terms of speaking to doctors and nurses about what they were looking for. How did that process come together?
There's been a lot of input from nursing and physicians. We've gone as far as to reach out to our admitting hospitalists. We've talked to our social workers, our psychiatric care providers about what their needs are. So we've really tried to make a very concerted effort to get everybody's input so that we can address their needs moving forward. At every single meeting, there is nurse representation as well as physician representation. This has been going on weekly meetings for probably 4 years now. So there is a very concerted effort to make sure that we get a lot of clinical input into this. So we're sitting down with the architects, down with the facility people from the hospital, and really trying to get this right from all perspectives.
And Deb, as Executive Director for Patient Care at Cape Cod Hospital, I wonder whether there was any outreach to patients or whether you talked to them about what their expectations are when they come to an emergency department.
Well, we do get feedback from our patients daily. We do callbacks on patients, and we do listen to feedback on what's working for them and what isn't working for them. And we realize that waiting is a big concern, and privacy, as I said before, is a big concern. So we as caregivers want to provide safe care for the patients and be able to create an environment that encourages our community to use our services and feel comfortable with us and have a positive experience.
And we were talking before the show about meeting the needs of the community and in terms of the workspaces, and I picture that as being that the layout is so important for this. What was some of the input that went into putting together this layout?
I think that one key piece to this is that we want to be able to observe our patients for the obvious reasons, but we want to give them a sense that they have privacy and the center's voice for their own care, for their plan of care. So we're offering them privacy with their families. The families will be encouraged to stay with the patients. There's sitting areas for them. On the other hand, we've stationed the nurses so that they will be able to observe and respond as needed. And they'll be able to respond differently in that any of the trigger devices, such as alarms, etc., will go directly to the nurse so that the noise within the department is much more tolerable.
And speaking in general about the emergency rooms in the Cape's two hospitals, Cape Cod Hospital and Falmouth Hospital, what do you see as some of the challenges in the emergency room here? And you said that perhaps the majority of the patients are senior citizens, of course, but we do have other challenges here with it being a seasonal community. And what are some of those challenges in the emergency rooms at the Cape's two hospitals? Art?
Well, being the bureaucrat at the table, I think the biggest challenge from my perspective is the ability to flex staffing up and down as needed as the volume changes. It's also very challenging to provide compassionate and private care when the volume goes up and patients are in stretchers in a nurse's station as opposed to in a private room. And if I could, I'd just like to say a little bit more about what Deb was just saying relative to the patient experience. We've talked a lot this morning about the shortcomings of our existing spaces, but we're very proud of the fact that when our patients fill out their satisfaction forms, they consistently come back ranking us in the 98th to 99th percentile against our peer organizations nationally. So the compassion, the focus on the family, the focus on the patient as an individual is there, and it will only be enhanced when we can provide a physical environment that matches that level of compassion.
And for people wondering if they are visiting the emergency rooms over the next 6 or 8 months, of course, you're fully operating at both hospitals while these projects are going on. Is that right, Doctor?
Yeah, one of the keys to this was not to lose operational space while we were designing the new ERs. So the build is going on with very minimal impact to the current operation. We were already overstretched, so to lose even 2 or 3 beds per facility would have been devastating. So there's almost no interruption in clinical care whatsoever.
So this has been an interesting overview of these 2 expansion projects at Cape Cod Hospital and at Falmouth Hospital on the emergency rooms. Unfortunately, we're out of time. Thank you all so much for coming.
Thank you.
Thank you.
I'm Laura Reckford, and this is Sunday Journal.
This podcast is a presentation of Cape Cod Broadcasting, which is solely responsible for its content. Thank you for listening. For more information, please visit us at capecodbroadcasting.com.